This segment of DelmarvaLife is sponsored by TidalHealth.
If you think a bad night's sleep just means a little extra coffee the next day, think again. From snoring and insomnia to more serious conditions that can impact your heart, lungs, and overall health, sleep plays a bigger role than many people realize.
And today we are joined by Dr. Jacques Conaway with TidalHealth to talk about the growing field of sleep medicine. Welcome to Delmarva Life. Good to see you.
Thank you for having me.
Before we get into sleep medicine, I want to just talk about sleep in general. Why is it so important? Good sleep is so important to our health.
Great question. I want your viewing audience to understand today that sleep is essential to overall health. It is not a luxury item, okay? It's not the finest cut of steak at Ruth Chris and a glass of wine. It really is vital to health. It's as vital as having a balanced diet. It's as vital as maintaining hydration and drinking water. It's as vital as the air that we breathe. First of all, a good night's rest is essential for adequate brain health. This is how we can formulate memories. It consolidates memories. It also improves mood. We know that a good night's sleep is also important for cardiovascular health. Did you know that there are cohort studies that clearly show when your sleep is reduced to less than 6 hours, there's an increased risk of cardiovascular disease, including a heart attack.
And that's where you come in. So what is exactly sleep medicine?
So sleep medicine is focused on improving sleep and wakefulness in patients. And we treat a variety of illnesses. Sleep apnea being one that is somewhat popular these days. But I think a larger issue that we see in our offices are patients with insomnia. Insomnia being the inability to fall asleep, to stay asleep, waking up too early. And there are a variety of other conditions that we treat in sleep disorders, including restless legs. We do work with shift workers who have difficulty maintaining sleep and staying awake when they need to be awake. We do the entire spectrum at TidalHealth Sleep Medicine.
So what are some symptoms that people should not ignore when it comes to sleep?
Sure. Waking up and feeling tired occasionally happens. However, when it is consistently happening every morning and every day, it is not normal, and that could be a symptom of an issue. The same goes with inability to sleep at night. We've all occasionally had some difficulty falling asleep or staying asleep. But when it's happening on a night-to-night basis, that generally means there could be a significant medical problem that needs to be addressed.
So are there any symptoms that people should absolutely not ignore, like as soon as you realize them?
Sure. I think that if you're behind the wheel of a car and you're falling asleep, that is a sentinel event that probably warrants at least a discussion with primary care. Extremely loud snoring. Oftentimes the patient doesn't complain of that. It's the bed partner, right? If you hear this out of your loved one, if you hear them making gasping and choking noises at night, that is not normal and probably warrants some type of a medical evaluation.
Sure. And TidalHealth is investing into sleep on Delmarva with the Sleep Medicine Fellow. What does that mean for the community?
Sure. You know, the American Academy of Sleep Medicine estimates that there may be a little shy of 6,000 board-certified sleep specialists in the United States of America. Did you know that they also project that there are about 70 million people that have sleep disorders?
Wow.
The numbers don't quite add up, right? There's clearly a shortage of sleep professionals. TidalHealth is going out of its way to assure that we are training physicians for the future, training physicians to take care of patients in this community, and specifically patients that have sleep disorders.
All right, so if somebody's watching right now and they think they've got something they might want to get some help with, what's the first step?
I think the first step is probably talking to your primary care provider, and then that provider may elect to send you either to a sleep specialist like myself, or may elect to do some sleep testing on you to determine exactly what's going on.
Okay, so you don't necessarily have to have a sleep test to be treated for?
Not necessarily. In fact, it's not unusual when patients present with insomnia. We don't typically do sleep tests on them because we would universally find they're not sleeping.
Right,
Right.
right. But it's worth talking to your primary doctor about.
Yes, it certainly is.
All right.
Don't
Yep.
ignore your sleep.
Don't ignore your sleep.
so
It's not
important.
a luxury.
And when you do get good sleep, you notice it. You feel better.
Yes, you do.
Dr. Jacques Conaway with TidalHealth, thank you so much
Thank you.
for coming in.
Thank you. My pleasure.